Hi, it's Dr. Noel Williams, Optimal Health Associates, COVID update, the 18th of December. If I look a little serious or miserable, I'm not. My back's out and has been for a while, so I can't move. It's great. I love this old age stuff. So a couple just background things. A big yell. I'm not allowed to say shout out anymore. Kim says that's it's passe. But a big yell out
No.
to the most awesome group in general, the CMOs of Oklahoma City, and I am so happy for Julie Watson being recognized in the 405. Dr. Julie Watson, she's gotten some other recognition recently, but as one of the 10 people moving Oklahoma City forward in the next 10 years, she just needs to continue to be promoted at Integris. Go Integris. And more responsibility, and let her do her thing because she's amazing, and she deserves every positive word about her is an understatement, is what I can say. So, and a big shout out to all the leadership at all the hospitals. Their COVID numbers have come back up this week, and they're seeing a lot of people for infusions. And one of the things about the infusions, and again, not a shout out, but a big praise to Oklahoma and Oklahoma City, whose COVID care is fantastic, with the ER doctors and the ER nurses and the intensive care people and all of these folks. But it's the little things too, like these infusions, because I have a cousin in Chicago who got symptomatically ill with COVID. He's vaccinated, the whole family's vaccinated, they all have COVID, it's clearly Delta. I put him on the usual mix of things, and he's progressed. And so today, and he couldn't find an antibody infusion anywhere locally. His doctor's hospital doesn't do it, so his doctor who suggested Tylenol too, which is my favorite recommendation next to Jello for COVID, people who are symptomatic. Said, well, I can't help you. Our hospital doesn't do it. So I then asked them to just call around, and they could the first antibody infusion they could get scheduled is Monday at 1 p.m. in Milwaukee. I'm like, oh my goodness. So now he's sick. He's sicker today. He has a COVID pneumonia, and he called the hospital. I told him, well, you're going to need to go to the ER. You need a full evaluation now, and see if they have antibodies, so they'll infuse you. So the first hospital that he found that had antibodies and they do infusions said, well, yeah, but we won't give it to a vaccinated person even if they're sick. He's within he's day 1, 2, 3, 4, day 4 from his first day of symptoms. I'm like, because in Oklahoma, again, our leadership of the hospitals would give it to high-risk people who were symptomatically ill with COVID and asymptomatic with COVID, or mildly symptomatic with COVID, I should say, who are prior vaccinated, because they're at high risk, and he's at higher risk with heart disease and hypercholesterolemia and hypertension. And he's famous in our family because he's the noted homemade sausage maker in the Marzano family. So anyway, it's very frustrating. I'm glad even though we have problems here, our problems certainly seem small compared to what he's facing in Chicago. Likewise, one of my, this is just another sidebar comment about why this is also screwed up, and we're just going to have to live through the next few months. One of my staff's children was diagnosed with COVID about 10 days ago, and when the doctor came in and told the little guy, who's about 5 or 6, that he had COVID, he broke into tears and thought he was going to die. And that whole messaging with this kid stuff and scaring the kids is utter nonsense. It's really, as I had said before, 1 to 2 in 100,000 kids get hospitalized with COVID. If you look at the current data from the CDC, that's this week's data, it's 1 per 100,000. So, you're going to die, or if you da-da-da-da-da. And he did fine. He was sick for a few days mildly, and he's great. But his wonderful mom, who will remain nameless, who I've worked with for a long time, said, you're set now. You have a force field against COVID because of the antibodies. And since he's into like superheroes, he thinks he's a anti-COVID superhero now. So that's awesome. So silver lining on that. So that's kind of and those stories are kind of meaningless vignettes, but in some respects, that's what everyone's going through in the country right now. Some data out of Michigan, just comparing school districts. Again, I have to be careful now about everything I say, because if I get another strike, I think it's some ungodly length of time when I'm banned. So comparing school districts' infection rates in masked school districts versus unmasked school districts, it's essentially the same. There's no effect. Interesting study. Draw your own conclusion. I've given my opinion on masks with Delta. Again, performative, but be that as it may. The number one thing to decrease indoor transmission of COVID is the circulatory rate of the air system. That's been shown now repetitively. That's why hospitals are supposed to change theirs and increase the circulation rate, and that will decrease intra-hospital transmission of COVID. And again, since iatrogenic or hospital-based or clinic-based transmission is very important to stop, these little tidbits are very important for everyone to know. So there's that. There's the pulse of COVID in the central north or northern Midwest, so Chicago, Wisconsin, etc., is Delta, and then the Northeast is Delta. It's Omicron's coming on, but again, the Omicron data still remains very consistently what little we have before we get spastic. That is, it is more infectious, but it's also very, very, very mild disease. And so ultimately, it's probably going to be a solution. We still need to wait, but I'm leaning towards it's a solution to COVID, not a worsening of COVID, because the bottom line is the vaccines are not going to be the solution for this. Again, I want everyone who's not been vaccinated to get vaccinated. Surprisingly, the CDC now has said that the J&J shot does cause significant amounts of blood clots. And again, relative to its benefit, you can argue that very clearly that it was beneficial to give the J&J, but I want to also be clear, which I've said from the beginning, people needed to be told there were some risks and some cardiovascular risks and blood clotting risks with the J&J at least, and I kind of felt it's potentially there with all of them a little. And they should have all been put on aspirin beforehand or fish oil, and that would have been a very easy recommendation. And acknowledging risk and being honest, which gets you shunned by sometimes by social media or your fellow medical community or whatever, is how it is now. And then the Moderna definitely has an elevated risk for cardiac events. It's small, but it's definitely there, and I think we need to remember that. And again, the solution to most of the complications cardiovascularly from any kind of vaccine is being on aspirin for a few days before and after, as long as it's not a problem, or chronic use of fish oil. I mean, I want everybody on fish oil. I mean, that's part of our thing. And that's one of since we're all going to be confronted now with COVID again, and the Merck drug is not really available. I can't find it anywhere in Oklahoma City to call in for people. What do? So your baseline vitamins are always going to be your multi, your fish oil, and your vitamin D. You should just do that anyway. It's smart, it's meaningful. But with COVID being prevalent, it being flu season, 15 milligrams of zinc, it is pretty reasonable. Some people, who've been on it for a while, we used to start at 50. 50's great. But if you're on it 50 milligrams for a week or two, and there's a little more upset stomach and stuff, you can go to 50 milligrams 3 times a week. So that would be, you always want to do that stuff. It's just your baseline now of things you have to do that's going to fight off cancers or lower your risk for cancer, heart disease, Alzheimer's, dementia, osteoporosis, all this stuff. Really important. Then, with COVID, if you're at higher risk, you want to be thinking about, hey, should I be on a little quercetin daily? Should I be, on turmeric daily? Also. But then if you get COVID, what do? So from a supplemental point of view, you want to try to get in 200 milligrams of zinc in the first 24 hours after your diagnosis. The reason is the zinc is toxic to the COVID viral particle. That's been shown in a lot of different research and been confirmatory. So it's always helpful so that can help knock down your viral particle rate. And the problem with zinc is it upsets the stomach. So you have to split your dosing and do 30 to 50 milligrams with food every 2 to 3 hours. Then, you'd probably skip the next day and then take 50 a day for the next few days. 2, you have to start, especially if you haven't been on fish oil, you really need to start some baby aspirin or full strength aspirin for at least a week. But check with your doctor before doing that, or your healthcare provider, to make sure, but at least a baby aspirin for a week, because there's clear associated data that lowers the death rate. Third, you want to add your vitamin C in as a super potent anti-natural inflammatory, probably 1 gram 4 times a day. But with the fish oil, with the multi, with the vitamin D, and get all that going. And then again, there's elderberry too. And so again, I have a prior written post on this, which I'll republish this week, because we are going to be faced with Omicron, and people are going to get it. It's going to be mild for 99, it looks like 99+% of people. But every now and then it's going to get worse for somebody. So let's be ready for it and fight it off. Those are the big things I wanted to go over. Kim, was there anything else?
Happy birthday, Tina.
Oh, golly. Tina Telkachi is having a big birthday. It's not 20, and it's not 30. It's not 60. So, but it's a big birthday. So happy birthday, Tina. Happy birthday. And then big thanks out to all of our staff at Optimal Health Associates, my partners, Cassie Smith and Ben Berenberg. Big shout out to Jeff Griffin at Digestive Disease Specialist, the president, and the DDSI physicians for their help and support over the last years and months. Special thank you to Zach Schmidt, who knows why. And then thanks to all of our friends and supporters. Big thank you to Danny Barnes for working in Someone Quickly for me this week. Alita Toma for always being there for our patients. The usual suspects of everyone who makes our patient care fantastic, because we're really good at what we do, but we're really good at knowing when we need help. And so I have this fabulous group of physicians and PAs. Paul Jacob and his team, great example, are just the bomb. So again, many thanks to many people during this holiday time. So again, take your vitamins. I'll talk about vaccination and boosters probably tomorrow, but I'll have to be careful about that, because the rush to do boosters with the lack of science continues to flabbergast me, but and I don't want to have a major strike again. So anyway, take care and good night.